kids, Psychology 266. Today we do section 2 of the reading packet. This one is kind of unfortunate that we're doing it online instead of in person, because there's so much more we could do if we were in a room talking to each other and passing things around. You'll see what I mean here in a minute. Diagnosing and assessing people. Guess what? Other than working at Chandler Gilbert and teaching psychology and working in our disabilities department and other things, I am a psychologist and I diagnose and assess people. So this is a perfect chapter for me, isn't it? Section 2. So it all starts with the assessment piece. In my line of work, it's pretty common. I work for the juvenile court mostly. The judge wants to know, so what's going on with this kid? Is there a name for what he or she is doing? Is there anything that we can do to help keep this kid out of trouble and get him or her on the right track? And the answer is usually yes. We do a psychological evaluation. It involves several different things that we are going to talk about now. So, first of all, record review. I want to get as many records about the person as possible. To be totally honest with you, sometimes it's overwhelming. They can give me several hundred pages of documents about people, from school records, hospital records, arrest records, all kinds of things. This is going to sound a little crazy because usually when I'm teaching in person, I'm the oldest one in the room these days. And there are probably more records about you than me. If I'm much older, how could that be? Well, because back in the day, records were kept on paper, and you threw away those papers when you didn't need them anymore. Well, now records are online, and they're in databases, and they're saved on hard drives and external sources, and they're saved online, and some are password protected and some are not. There are so many more records about people now than there used to be. Records are only as good as the people who put them together. We're not guaranteed that they're complete or that they're accurate, but there are a lot more records than there used to be. Interviews. I want to interview as many people as possible when I do an evaluation on someone, especially a kid in the juvenile court system. Parents, I want to interview school teachers and principals. If the kid has had a job, if the boss will talk to me, sometimes that's relevant. Interviews. Testing. This is the one thing that psychologists can do that other people can't. Anybody could read records, anybody could do interviews, anybody can observe behavior, but it's the testing that is unique to psychologists. So, let's go into more detail. We just talked about the records. I want to get as many records as reasonably possible so that I can read them and, make my own report consistent with what I read in the records. Clinical interviews. They can be structured or unstructured. What does that mean? Well, structured means you ask very exact, specific questions. How long have you worked here? What grade are you in? Are you taking any medicine? Those are very structured questions. But unstructured is merely having a conversation with the person. You can see the pros and cons to both. If you ask structured questions, at least you get very exact questions asked and answered. But unstructured, that could be advantageous too, because maybe there's things you didn't think of that the person wants to tell you. Or maybe you make the person uncomfortable with a million questions, and they would rather just have a normal conversation with you. So you can do a combination of structured and unstructured, but there are differences between the two. Psychological testing. This is interesting to people who study psychology because they're learning a skill that other people don't know and are not experts in. And again, this is why psychologists are called in to do the testing. So let's move along here. We'll get back to testing here in a minute, as you can see on the bottom of this page right now. For these psychological tests, there is reliability and validity that is needed. Reliability means the consistency of factors. In this case, if I test you twice and nothing has changed, or even a third or fourth time, hopefully your results don't change. A good example is a bathroom scale. If someone weighs 150 pounds and then they weigh themselves again and they're 151, that's pretty reliable. That's very consistent, even if it's not exactly the same. Well, if I give you an IQ test or a test of depression or whatever, and you score almost exactly the same because nothing has changed in that period of time, it is reliable. Validity is a very different question. Is it really measuring what it's supposed to measure? That's validity. If a test is supposed to measure aggression, is that really what it's measuring? What if it's supposed to measure love or sympathy or whatever else? We want it to be valid. And you know what? With IQ tests, they're not always considered to be valid. There are cultural and language and motivation aspects to IQ testing, so maybe they're not measuring intelligence like we hope they do. But a test of anger or aggression or even depression, we hope it's measuring what it's supposed to measure. Personality tests can be either objective or projective. Objective is kind of a silly word when you're talking about yourself. Self-report is a better term for it, I think, but we'll call it both because it does have two names. You're supposed to try to be objective about yourself and your own issues. Am I really angry? Am I really sad? Am I really hearing voices? You want to be as objective as possible. Usually there's some kind of number score, and we get a score about how depressed you are or perhaps how angry you are. The most widely used, this is one you want to know, the MMPI-2, the second version of the Minnesota Multiphasic Personality Inventory, the second edition. Here's another thing you want to know. It has 567, yeah, that's a lot, questions that are true-false on this particular test. It adds up to clinical scales, such as how depressed you are, how psychotic you are, how anxious you are, but also validity scales. It's really interesting that it measures, do you have a tendency to lie or exaggerate? Do you have a tendency to fake good or fake bad? Maybe you want to look like you don't have any problems. Maybe you want to look as troubled as possible to get out of the problems you do have. So that's what's interesting about the MMPI is not only the clinical scales, other tests have that too. Are you depressed? Are you angry? But validity scales. Is it really measuring what it's supposed to measure? And are you trying to fake one way or the other? Projective tests. This is favored by psychodynamic, Freudian, psychoanalytic psychologists. How come? Because it's supposed to delve into your unconscious, things that you're not even aware of. And honestly, I have mixed feelings about these tests. Some of them are a bit of a reach, as I would call it, because maybe we don't know if it's really measuring your unconscious. But other times it's really interesting where people will divulge things, admit to things that perhaps they didn't even know they were thinking. We wanted, or I wanted you to know one of these objective tests, the MMPI, but two of the projective tests, because they are equally famous. Perhaps you've heard of the first one more than the second one. I bet most people have. Rorschach inkblot test. Rorschach was a psychiatrist over 100 years ago, and he was with his daughter one day, and they were looking at clouds in the sky, and his daughter thought they looked like things. It looks like a princess, it looks like a pumpkin, and Rorschach thought, it doesn't look that way to me, but that's what's coming out of her unconscious as a little girl. Maybe somebody else would see it differently. So instead of pictures of clouds from the sky, Rorschach got the idea of using ink blots. And what you see in the ink blot is representative of what's in your unconscious. The TAT thematic apperception test is what you perceived from an animated drawing. And instead of just saying what it is, you're supposed to tell a story about it. So let's look at one of each. First of all, this one is a real TAT picture. What do you see there? Is that her when she's older? Is that an older woman trying to harm the younger woman? Is that an older woman thinking of what she was like when she was young? Are you seeing kind of a Snow White theme here from Disney? There are just so many possibilities. Whatever is in your unconscious is what's on your mind, basically. So you would tell a story of what you see here. And you would not only do this one, you do 10 to 12 of these cards to get a good representation of your unconscious. Whereas this picture is a real Rorschach picture. What do you see in that ink blot? Does it look like two wolves facing in opposite directions? Is it a scary mask? Is it coyotes that are bleeding with these little, dots at the bottom here? What is it that you see? It could be a number of things. There, I made it a little smaller so you can see the whole thing at one time. Do you see pelvic bones from anatomy and physiology? Is it a bat? Is it a butterfly? Unconsciously, you will see something for a reason that you're not even aware of. That's the whole idea of the unconscious. Okay, that's the assessment part, but now the diagnosis part. Psychologists, psychiatrists, even some counselors and social workers use this book. And again, it would be more fun in an in-person class to do some Rorschach and TAT and other tests together. It would be more fun to pass around this book, the DSM-5. What does it do? It helps you diagnose people. Psychologists joke that this is the Bible of our profession. It's daily reading. Well, what does it do? It tells you what the symptoms are, and you look up conditions and see if the person actually has it, like depression or schizophrenia. Why is it called DSM-5? Well, it's the Diagnostic and Statistical Manual. That's the book that we use. About every 20 years, they come up with a new one. And this is the 5th edition. It'll probably be around for about 15 more years or so. It's hard to tell when they come up with a new one. Why did they come up with a new one? Well, things change in society. We didn't used to have internet addictions. Conditions like homosexuality used to be in there, and now they're not unless the person is distressed about it. It's not that society will judge you for having it as a disorder. It's now whether you are upset about it yourself. Some of the conditions change names. For example, there is no Asperger's disorder anymore, no multiple personality disorder, and not even any stuttering. Those all have new names, believe it or not. So sometimes I think they just rename things to drive people crazy, but that is part of how progress is made, that research is done in psychology and related fields, and then we know just a little bit more about human beings and their psychological issues. So, the last part of my reports is often to diagnose people. Maybe I shouldn't say the last part. It's one of the last things I do, but I kind of put it in the middle of my evaluations. And the whole idea is to have the testing and the interviews and the observation of the person back up with your eventual diagnosis of him or her. And yes, we do observe people. Does it look like you're upset or you're angry or you're happy or you're laughing? So in the first part, observation is part of an assessment, but it's not nearly as important to psychologists as the things they can do that other people can't do, which is mostly the testing and the diagnosing. So that is it for section 2. Take care.